Stop right there. So you got to make sure that the knees can hang off the table just a little bit with them. Right? Then you're going to bring this. Sit back down, please. Okay. So, okay, stay still. I'm going to bring your knees up. And then what we're going to do is we bring both knees up just so the back flattens out. You're not going to pull them to the chest, just so the back flattens out. What I'd like you to do is just hang on to this one knee. Do that. So,
hang on.
Oh, okay. I thought you meant like don't let it
please.
move.
Both hands. Leg it in. Okay. But don't, just hold in that. Don't try to pull it toward your chest. Then what we're going to do is we're going to take this leg and keep it flexed. And this is where it says stick out your booty and stick out your chest. So you can get a good body mechanics. So your butt's that way, your chest is this way. So you got good body mechanics, and you lower the leg down. And if it doesn't, see the space there? Okay, so it's not hitting the table. So that's a positive Thomas test. And the Thomas test, hip flexors are the iliopsoas and the rectus femoris. And the way you determine which one it's coming from, first thing you're going to do, if you notice it's positive, is you're going to measure at what angle of the hip it is. And the second thing is we're going to notice what angle the knee is. If the knee remains at 80 degrees of flexion or greater, it is the iliopsoas. If the knee is extended greater than 80 degrees, meaning 75, 70, 60, whatever you get, then it is from the rectus femoris causing that. If the leg were to go flat on the table, it would be a negative test. Okay? Negative test with the knee remaining flexed at 80 degrees. So, again, you can read all the depth of why we do this position and what it means and all that, but simply, so what's good is we got an example. Positive Thomas test does not lie flat on the table. Knee is not extended to 80 degrees. Did you have a positive Eli's test too?
Yes.
Mm-hmm.
Okay, probably makes sense. Two joint muscles, tight over the knee, limiting the knee. It's probably tight over the hip too. So it's funny how those things go together. So that would be the Thomas test. So you are lowering it. So what you want to do is try to keep that knee in that position. I can see right as I get to there, it starts to extend. You know, so that's where I'm thinking it's rectus. So again, we're going to measure the angle at the hip and then the angle at the knee. The angle of the knee will tell you if it's iliopsoas or rectus. Knee stays flexed to 80 degrees, it's iliopsoas. Knee is extended greater than 80 degrees, it's rectus femoris. Okay? Thomas test, both sides.